Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Oxygen therapy. Introduction. Oxygen therapy is a treatment that provides the body with extra oxygen. The body needs oxygen to work well. Oxygen therapy may be used short-term. For example, it may be used during an emergency. It may also be used long-term, such as in people with chronic lung diseases. The oxygen may be given in different ways. This program explains oxygen therapy. It talks about what oxygen therapy is, who needs it, and how it works. The program also covers the risks of oxygen therapy. Oxygen and the lungs. The respiratory system is a group of organs and tissues that make breathing possible. It includes the airways and lungs. The lungs allow the blood to fill with oxygen. Oxygen is absorbed into the blood in the lungs. When a person breathes in, air enters the body through the nose or mouth, which moistens and warms the air. The air then travels through the voice box and down the windpipe. From the windpipe, breathed air goes into tubes called bronchi. These tubes enter the lungs. Within the lungs, the bronchi branch into many tiny tubes called bronchioles. At the end of the bronchioles are small balloon-like sacs called alveoli. The walls of the alveoli are very thin. Around the outside of the alveoli are small blood vessels called capillaries. The capillaries connect to a network of arteries and veins that move blood throughout your body. Oxygen goes through the very thin wall of the alveoli and into the bloodstream. Carbon dioxide goes the other way, from the blood to the lungs to be breathed out. Oxygen-rich blood travels to the heart through the pulmonary vein and its branches. The left side of the heart pumps the oxygen-rich blood to the body's tissues. The right side of the heart returns blood from the body to the lungs. Oxygen therapy. Normally, the lungs deliver oxygen to the blood. The body needs oxygen to get or make energy from the foods we eat. Sometimes the lungs cannot get enough oxygen into the blood. This can happen due to certain medical problems, such as lung diseases. Oxygen therapy can help when the lungs cannot get enough oxygen into the blood. It provides the body with extra oxygen. For oxygen therapy, oxygen is supplied in a container, such as a metal cylinder. The oxygen can be delivered from this container to the body in different ways. No matter how it is given, oxygen therapy helps many people feel better and be more active. It can also help decrease shortness of breath and tiredness, improve sleep, increase the quality and length of life. Oxygen therapy may be given in a healthcare facility or at home. If it is done at home, it is usually used to treat a chronic or ongoing disease. If you need long-term oxygen therapy, portable units are available. These units make it easier for a person to move around and do daily activities while receiving oxygen therapy.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Who needs it? Some health problems can prevent the body from getting enough oxygen through the lungs. This causes a low blood oxygen level. A low blood oxygen level can be dangerous. Your body needs a certain level of oxygen in the blood to work properly. Oxygen therapy can treat a low blood oxygen level by providing the body with extra oxygen. Oxygen therapy may be given to people who are being treated in a healthcare facility for serious illnesses. These illnesses may prevent the body from getting enough oxygen. In such cases, the oxygen therapy is stopped once the person has recovered from the illness. Short-term oxygen therapy may be used to treat a severe asthma attack, premature babies that have serious lung conditions, severe cases of pneumonia. Oxygen therapy can also treat chronic diseases. This type of long-term therapy is often done at home and may be used to treat COPD, cystic fibrosis, late-stage heart failure, sleep-related breathing disorders. A low oxygen level may also have other causes. Talk to your healthcare provider if you feel short of breath or have trouble breathing. How does it work? Oxygen comes in different forms. It is supplied as a concentrated form taken from the air, compressed gas, liquid. Oxygen concentrators filter out other gases in the air to store oxygen. These concentrators come in several different sizes, including portable units. Oxygen concentrators cost less because they do not require refills, but they run on electricity. If you use an oxygen concentrator, you will need a backup supply of oxygen in case of a power outage. Compressed oxygen gas is stored in metal cylinders. The cylinders come in many sizes. Some are small enough to carry around. They may be put on a small wheeled cart or in a shoulder bag or backpack to carry around. Liquid oxygen is very cold. When it is released from its container, the liquid becomes gas. This type of oxygen is delivered to a person's home in a large container. Portable units can be filled from the large container. Liquid oxygen is more expensive than other types of oxygen, but the storage units take less space than other types of oxygen. Oxygen can also be delivered to the lungs in different ways. It can be given through a nasal cannula, which consists of two small plastic tubes placed in both nostrils. Face mask, which fits over the mouth and nose. Breathing tube inserted into the windpipe through an incision in the front of the neck. Oxygen therapy is most often given through a nasal cannula. To help hold the cannula in place, the tubing is placed around the back of the ears and under the chin. From there, the tube attaches to the oxygen container. A face mask is often used if a high flow rate of oxygen is needed. It can also be used if the nose is clogged from a cold. It is held in place with straps that go around the head. The oxygen enters the mask through a tube in the front of the mask. If oxygen is delivered through a breathing tube, it is called transtracheal oxygen therapy. This type of therapy also uses a humidifier attached to the oxygen system. This adds moisture to the oxygen and prevents the airways from getting too dry. Risks and complications. Oxygen therapy is very safe, but there are some risks and possible complications. Most types of oxygen therapy may only cause minor complications, including dry or bloody nose, morning headaches, skin irritation from a nasal cannula or face mask, tiredness. Tell your healthcare provider if you have any of these complications. Your healthcare provider may change the oxygen flow rate or length of time you use the oxygen. If you have a dry nose, you may be given a nasal spray to use. You also may be able to start using a humidifier in your oxygen system. If your skin is irritated by a nasal cannula or face mask, you may get a device that fits better. You may also be given over-the-counter gels or other devices that can lessen the irritation. Complications from transtracheal oxygen therapy can be more serious. Possible complications include infection, injury to the lining of the windpipe, mucus blocking the windpipe or tube, problems with the tube slipping or breaking. The risk of these complications is reduced with proper medical care. Talk to your healthcare provider to learn more about how to correctly care for a breathing tube if you have this type of oxygen therapy. Oxygen is also a fire hazard. Oxygen itself is not explosive, but it can worsen a fire if one happens. The cylinder that compressed oxygen gas comes in can also explode if it gets too hot. You will need to take certain safety steps to avoid any problems if there is a fire. For example, you should never store compressed oxygen gas cylinders and liquid oxygen containers in small, enclosed spaces. Talk to your healthcare provider or home equipment provider to learn more about safely using oxygen.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Oxygen therapy is a treatment that provides the body with extra oxygen. The body needs oxygen to work well. Sometimes the lungs cannot get enough oxygen into the blood. This can happen due to certain medical problems such as lung diseases. Oxygen therapy may be used short-term, like during an emergency. It may also be used long-term, such as in people with chronic lung diseases. The oxygen may be given in different ways. It can be given through a nasal cannula, face mask, breathing tube. Oxygen therapy is very safe, but there are some risks and possible complications. Most types of oxygen therapy may only cause minor complications, including dry or bloody nose, morning headaches, skin irritation from a nasal cannula or face mask, tiredness. Transtracheal oxygen therapy can cause more serious complications. The risk of these complications is reduced with proper medical care. Oxygen is also a fire hazard. It can worsen a fire if one happens. Talk to your healthcare provider or home equipment provider to learn more about safely using oxygen.
Thank you for using Explain.